and I've forgotten to start recording. So I'll probably repeat what I said already. So basically, mental health versus brain health. What happens is, I was talking about the stigma attached to mental health challenges. And because of the stigma, a lot of people who can actually be helped are not seeking the help that they deserve, definitely, and that should be able to help them to a great extent. And even amongst those who do go for treatment, now, if you are someone who's been dealing with mental health challenges, and or you have a loved one who's going through something like that, you know that how difficult it is for everyone. And again, I'm not talking about, just the mild type of anxiety or depression that you can, it doesn't affect your day-to-day life, but you know that people who have mental health challenges very often are not able to continue working. Many of them are on disability, and that depends on which country you are in. Some countries don't have disability. So overall, and even, they have poor relationships, they have, overall, it's like a lot of challenges that people go through. And unfortunately, the awareness amongst people is not there that mental health challenges deserve the same kind of solutions that we would provide for something like hypertension or diabetes. Somehow, unfortunately, this thinking still exists that if you have diabetes or hypertension or heart disease or even cancer, then you are not to be blamed. You are not to be blamed for any illness. But when it comes to mental health challenges, somehow it's like, oh, you're not thinking positive, or your lifestyle is, not good, or you just get over it, sort of thing. So that is what my goal today. Of course, in this short time, I'll not be able to talk about a whole lot of things, but my goal today is, number one, are there other conditions which can sort of, show symptoms similar to many of the mental health conditions? And more importantly, what are the things you can ask your healthcare provider to provide you? Or again, it depends on where in the world you are. Some of the things I'm going to talk about, like brain imaging, it's not available everywhere in the world easily. So these are, but my point is, I want to share this knowledge so that at least you know what is available, and then you can figure out how to get that for yourself or your loved one. I am Dr. Shabnam Daskar. I'm a functional medicine doctor. I'm originally from India. I live in Alberta in Canada, and I have an online health and wellness company. I'm a brain health coach, and I have a certification in brain health coaching from Dr. Daniel Amen's clinic. And I'm also a certified tiny habits coach. And feel free to either type your questions in the chat box or in the Q&A. And I will make sure that you have enough time to ask your questions. And you will also receive a recording. This video will be uploaded to my YouTube channel, and you will receive a recording as well. And in case you think of some question later on, feel free to ask. Just email your questions to me. Okay, so I'm going to start sharing my screen. So as a functional medicine doctor, when I look at any challenge, whether it's a mental health, it's diabetes, hypertension, hormonal problems, anything, I look at it through the lens of, network of networks. Now you can see in this, in this image, that there are so many factors that impact your health, and all these factors impact your mental health challenges as well. Now you can see that, long COVID is something that I have had to add recently, because if you have experienced a COVID infection, as I'm sure many of you know, what they found, and sometimes these symptoms can continue for as long as 2 years, many people, even if they have had a mild COVID infection, have found that they have brain fog, anxiety. Many of them have found this crippling enough to be, not be able to work. And initially, doctors were just dismissing them off, saying, oh, this is not something, like, you've already had the infection, you no longer have the infection, this is not something that is relevant. But now we know that that is not true. So fortunately, a lot more research is being done, so that at least doctors are or your healthcare providers are not telling you that this is all in your head. But long COVID has a lot of long-term implications as well, which we will get to know in the years to come. But most importantly, what is it that you can do? Now, today's conversation is not about long COVID, but that is something that we have to keep in mind now, because if you are experiencing many of these, brain fog or depression or anxiety or any of these challenges, it is possible it is because of that. So that is where it comes along with chronic inflammation and infections. Your body's biological clock has a huge impact on your health. Environmental toxins, and I'm going to discuss one case where this was something very important when it came to the person's mental health challenges. Exercise, movement, you know that we spend a lot of time sitting, and sitting continuously is as bad as, actually worse than smoking. So sitting continuously also raises your inflammation levels, and high inflammation levels are associated with worse mental health challenges, with worse health in general, whether you look at brain health, heart health, gut health, mood issues, everything is related to higher inflammation of higher levels of chronic inflammation. The next thing is, now food. Of course, I have talked many times about food, and today I'm not going to talk about food, but you know how important it is. Genes, yes, your genes do not decide your destiny. It is what happens to your genes. So that is epigenetics. Epigenetics is basically whether your genes are going to be expressed or not expressed. So when it comes to mental health challenges, we know that most of these conditions like schizophrenia, bipolar disorder, they are not a problem of single genes. There are many different genes, which each gene has a small effect. So they are essentially what are called polygenic problems. And the same thing goes with, diabetes, hypertension, heart disease, any of them you name. All the chronic diseases are polygenic. So it's not one gene that causes all the problems. My point in saying that is, if you have serious mental health challenges in your family, it does not mean that you're destined to get that as well. There are a lot of things that can change that for you. For example, if you have these mental health challenges, but you are in a very loving relationship, you eat well, you sleep well, you don't sit continuously, your risk for any of these health challenges, whether it's mental health or other health, it's very different compared to maybe even your twin who does not do all those things for self-care. Then gut, immune, brain, I have talked about that before. Hormones have a huge impact on mental health. Thyroid is one of the big ones. Yesterday, I was on Clubhouse talking about how thyroid function impacts brain health. Medications, definitely. Metabolic dysfunction. In fact, I was very excited to see that there is a new metabolic psychiatry department at Stanford University, and Dr. Shivani Sethi is doing some fantastic research in that area. Stress response, therapeutic supplementation, these are things I've talked about before. So going back to brain health versus mental health, now, if we look at mental health challenges as something that is, that's a physical problem, then what studies have found, and I have seen this in my patients as well, sorry about that somehow that a lot of that stigma goes away, and the person who's going through all these challenges also feels a lot better, to the point where they're able to do a lot of the more difficult lifestyle changes that we talk about. So here I am, like I mentioned, Dr. Daniel Amen before. I have a coaching certificate from his clinic. So what Dr. Amen says, now, if you have gone through this, you or a loved one has gone through this, you know what happens when it comes to a psychiatric diagnosis. In psychiatry, they use something called a DSM criteria. So Dr. Daniel Amen says psychiatry is the only specialty in medicine that does not look at the organ it treats. So the organ it treats is the brain. And of course, the brain is connected to everything else, as I have mentioned before. So in psychiatry, how are diagnoses made? There is something called the DSM, Diagnostic and Statistical Manual. So if you have certain symptoms, like in depression, you don't, what is called anhedonia, you don't feel good about anything. So it's essentially, you look at a sunset, but it doesn't make you feel happy, it doesn't inspire you or anything. Or you have sleep problems, or you have a whole bunch of symptoms. So you are, your symptoms are sort of put through a list. And if you meet the criteria for those, then you are diagnosed as having that condition. Most commonly, most people don't go through lab tests, surprisingly. For me as a functional medicine doctor, I think like lab tests can tell you so much. They don't go through imaging, so they don't essentially look at the organ that they are treating. But you are given a diagnosis and you are given a bunch of pills, or your recommended psychotherapy. That is usually briefly what a psychiatric diagnosis is. And sometimes some people get well, some people don't get better, some people experience worsening symptoms, go back to the doctor again, and again you're given some more medication, or you're, so it's like kind of escalating. Then sometimes it happens that you're given a secondary diagnosis, so depression along with anxiety along with something else. Someone experiences hallucinations, then okay, this is psychosis. So basically, most of the diagnosis in psychiatry is unfortunately still based on only symptoms. And some physicians, of course, do some basic lab work to look for thyroid functions and B vitamin deficiencies and things like that, but not everybody does that. In fact, I was surprised at a psychiatric event when a psychiatrist said, "So do you mean we should be testing these for everyone?" And I'm thinking, don't you do that already? Of course, I'm not a psychiatrist, so obviously my view comes from the left of the field. As a functional medicine doctor, if you've ever gone through any of our programs, or any of if you've been my patient, you know that we do recommend a whole lot of testing. And in fact, we are accused of testing too much, but the fact is we always discover stuff that can be treated fairly easily. So that's kind of a long I've been talking for a long time to come to the point of this slide. So this is a paper which was published by Dr. Daniel Amen, and it says how brain spec imaging can improve outcomes and transform mental health care into brain health care. This paper is an open access paper, and if you are a healthcare professional, or even if you are interested in knowing more, this paper is not a technically difficult paper or anything. I would suggest that you should read that, because Dr. Amen shares the stories of many of his patients. Out of those, I have taken one patient because I thought this is very illustrative of what we could be missing. So his patient, Mr. C, suffered from crippling anxiety, extreme mood swings, panic attacks, negative thinking patterns, anger issues, difficulty sleeping. So this would be typically, a lot of people who are facing these kind of mental health challenges. And he saw a psychiatrist when he was a teenager, and he was diagnosed with multiple disorders. Like I said before, you get a primary diagnosis, then a secondary diagnosis, then maybe an additional diagnosis as well. So he was diagnosed with all these different conditions. So basically, he was also put on a whole lot of medications. Now, medications did not help him to the extent, many of them caused a lot of side effects. He ended up gaining a lot of weight. And as you know, people who gain weight, many of them, because of all the stigma attached to living with obesity, he was pushed into further social isolation. And as you know, social isolation is not good for anyone, and definitely not good for brain health. He became unable to work, and his family referred him to Dr. Amen. So this is something, and I have heard Dr. Amen speak many times, and I did his course. So on the course, this was something, one of my major moments of insight was, he said his SPECT scan showed indications of a past head injury and exposure to toxins. So when he, asked much more detailed history taking is always done. That's always a part of a functional medicine intake. What they found out was he had previous head trauma as a child. So what had ended up happening is his family owned some kind of a, I forget the exact term, you can read the paper for that. Basically, this man, even from a very young age, he was into speeding, I think I'm not sure what kind of, whether it was motocross or something like that. And obviously he was exposed to a lot of, gasoline fumes. And he also had a head trauma at the age of about 17 or so. And if you remember, Dr. Amen shared that, this patient was, he saw a psychiatrist when he was a teenager. But unfortunately, his head trauma was not connected to all these mental health challenges that he was going through. So in Dr. Amen's, amongst his patients, he does a SPEC scan for every patient of his. So he's got a database of some 198,000 SPEC scans. He says the commonest thing that he finds in his patients is a forgotten head trauma. And I remember him saying that sometimes you have to ask the patient 7 times because they forget. And when it comes to head trauma, you don't even have to be unconscious. It can be what is called, sometimes these terms are like misnomers. It is called a mild traumatic brain injury, mild TBI. There is nothing mild about a brain injury. But what happens sometimes is if you have not been knocked unconscious, you are just, you just have some headaches, you are just told to take some, painkillers, and then you go home and okay, yeah, you just had a head trauma, so you're going to go through these things. But what you may not realize, and sometimes people forget that they fell off the roof or something like that, fell off in the kitchen from, trying to reach something on a higher shelf. Sometimes people forget, and very often people fail to connect that old head trauma with all the mental health challenges that they've been going through. Now, obviously, this person, because of the head trauma, unless the head trauma was taken care of, his mental health condition would not better, so would not get better. And you can read the paper for, so this man eventually, when he saw what his brain showed him, brain spec scanning, he realized that this was not a personal shortcoming. This had an actual physical cause. So he made all the lifestyle changes. He got better. He lost weight, and so it's a good. But again, I must also say that not everyone may have such a nice and hopeful story. But my point is there is hope available. If you are someone who's going through these challenges, or you have a loved one who's going through this, this is a message of hope. It's not like, oh, everything is like doomed and you're just going to live life on disability all your life. So this is what SPECT scans look like. This is not of the same person. So a SPECT scan, you can see this one is a normal one, and this is from a traumatic brain injury. Now, SPECT scanning it's not so what it means is this is not an actual hole in the brain. This is basically energy levels in the brain. So the SPECT scanning does not show the physical problem. So this is not like how a CT scan or an MRI would show. So this is not an actual physical defect in the brain, but this is what happens with what it shows up on a SPECT scan. And as you can see, it's very different from what a normal person's brain would look like. And likewise, there are a lot of, if you go to Dr. Amen's website, or if you've heard him speak or read any of his books, you know that he talks about a whole lot of conditions where it shows a different brain image and SPECT scanning. And in his studies, he has actually published quite a few of them. Sometimes the diagnosis in as many as 79%, it can change to something else. So what are some of, at this point, I'm going to pause in case you have some questions, and I will talk a little bit more about, what can you do about SPECT scanning? Is that, how can you, whether you can ask your healthcare provider to recommend one for you. So I'm just going to pause a little while, and if you have any questions up to this point, and of course, I have more time for questions at the end as well. Okay, I don't see any questions or any, you can even raise your hands. And if you raise your hands, I think I can unmute you, but you won't be seen on video. So I am going to go ahead. So what are some of the other conditions which can show up with mental health challenges, like, show up with symptoms of mental health conditions, but they are not really that? So forgotten brain trauma is one I mentioned. Then sometimes it could be cysts in the brain. So again, a cyst or a tumor in the brain may show up as anxiety, depression, or it can show up as psychosis. A lot of mental health symptoms can show up, but the actual problem will not be detected unless the doctor is, your healthcare provider is astute enough to ask for a brain imaging. So cysts and tumors will not be diagnosed by just, going through symptoms. Then infections. I talked about long COVID already. There's something called PANDAS, which is, I forget the exact acronym, but it's basically and it's PANDAS is seen in children quite often. It's basically a consequence of a staphylococcal infection. A staph infection is, of course, a bacterial infection, but you know how the gut-brain immune system is connected. So likewise, infections can cause mental health challenges as well. Autoimmune conditions, lupus can do that. Then there are some specific to the brain. So if you have read the book Brain on Fire or even watched the movie, I felt the book was better than the movie, but again, not all of you like reading books. So Brain on Fire, if you haven't seen it or read the book, you can search for it online. This was a young woman who actually had psychiatric symptoms, and she was admitted in the hospital. But what she had was what is called anti-NMDA receptor encephalitis, which is an autoimmune condition against the NMDA receptors in the brain. But she showed up as with psychiatric symptoms, and this has happened to a lot of people, particularly if your healthcare provider is not aware of some of these autoimmune conditions, where the first symptom can show up as some psychiatric symptoms, and many a time they have been misdiagnosed and sent home with psychiatric treatment, whereas actual problem was something different, and obviously that needed different treatment. Yesterday on Clubhouse, I was talking about thyroid conditions. So hypothyroidism, that is low thyroid levels, and the commonest cause of hypothyroidism is Hashimoto's thyroiditis. So Hashimoto's is an autoimmune condition where your immune system makes antibodies against your thyroid gland. And as a consequence, your thyroid gland does not produce enough thyroid hormones. So you need to be on a thyroid medication, usually long term. But many a time, this is what I was talking about yesterday on Clubhouse, is you are not tested for thyroid antibodies. So if you're not tested for thyroid antibodies, you won't know whether you have Hashimoto's. Now, hypothyroidism is way more common than hyperthyroidism. So hyperthyroidism can also show up as brain dysfunction. And so any kind of thyroid problem, whether it is hypo or hyper, is also a risk factor for long-term cognitive decline if it is not treated well. Now, when it comes to thyroid conditions, what happens sometimes is the symptoms are very non-specific. Some people may experience low energy, brain fog, fatigue, a poor mood, and or generalized swelling of the body is a much later event. But unfortunately, what happens is when, particularly in older people, ageism is there everywhere. So if an older person experiences some of these, mental health challenges or cognitive decline, very often they are labeled as, oh, he or she just has dementia, whereas actual problem may be a hypothyroidism, which is not detected because they have not done the blood test. So you cannot detect hypothyroidism or hypothyroidism without lab testing. And anecdotally, and I'm sure it's there in the literature as well, I know of a lot of people, just because they were like 85, their doctor did not look at the thyroid function, and what he was actually dealing with was a hypothyroidism, which is fairly easily correctable, to the point where it also impacted his heart down the line, heart and brain function as well. And yesterday when I was speaking on Clubhouse, Jennifer, who is the co-creator of Tiny Habits for Brain Health course with me, she talked about her experiences when she was a young mother and she was experiencing all these brain fog and all these conditions. Her doctor initially just dismissed her off as, oh, you're just a new mom, you're not sleeping well, you have young kids. And what that was actually what turned out to be hypothyroidism later on. Now, unfortunately, many people have experienced this. The doctors telling them, oh, you don't need to do any lab tests. Now, as a functional medicine doctor, I don't understand that thinking, because for me, the reasoning is, if you can test, why should you guess? So if you are someone who's going through these conditions, please, or a loved one who's older particularly, or even younger, and women particularly in the menopausal, perimenopausal age, don't just accept that it's because you are a certain age or you are, whatever the reason is given. Keep on, you need to be your own health advocate. And I know it is not always easy. So thyroid conditions is one major, very important thing. And another thing is, some of the hypothyroid conditions are also related to mental health challenges. And I've talked about hypothyroidism in a different webinar, where people with bipolar disorder or depression may need a certain TSH level, which is in the lab range, but it could be much lower. So I can see I think there's a question and a raised hand. Yes, Deborah, thank you for agreeing with that. So if you can test, why should you guess? And we have another raised hand, and let me just, I'm sorry. I think I should just stop sharing my screen and look for the raised hand. Oh, who raised your hand? And I can't see you now. Oh, I can't see the raised. There you are. Okay, so I'm going to unmute you, Julie, so you can ask your question. Go ahead.
Hi there. No, I was just saying I'm finding this very interesting because I have hypothyroidism, and I was fortunate that my doctor actually tested my thyroid like without me having symptoms. But over the years, I have noticed I have higher anxiety. And this is the second webinar I've done recently that talks about hypothyroidism in relation to mental health. So I'll have to do some more research on that. So thank you.
Oh, you're welcome, Julie. Thank you very much. Yes, in fact, okay, I'm going to mute you. I don't know whether that would take you away from the screen. I'm not sure. So, yes, that is so true. In fact, few years ago, Harvard had did a blog post on, depression. Maybe the problem is in your neck. So the thyroid gland is here. So that is what they talked about. So I am just trying to figure this. So I've already answered. Done. Okay. Okay, so I'm going to go to the next section of what are the other conditions that can show up as with mental health challenges. I have completed up to thyroid. Next is menopause. Now, menopause is blamed for so many things, but unfortunately, in a way, it's like, this was a book. I think the name of the book is Spectrum of Hope. And this is a doctor who is actually someone who treats people with dementia. My major takeaway from that book was she talked about some women who were actually going through menopausal symptoms, but they were misdiagnosed as dementia because, again, like, ageism comes into it. You're a certain age and you're going through these problems, so it must be just, dementia. And she was given treatment for dementia, whereas when she came to this doctor, when she put her on hormone therapy, all her symptoms went away. And I'm thinking, yeah, I mean, that is one of the first things we would think of. But again, I guess I live in my own, my bubble, that as a functional medicine doctor, I would look at everything before making a diagnosis of dementia or any of these things. Because if it is something like menopausal hormone therapy, uh, treating for hypothyroidism, nutritional deficiencies, these are way easier than treating for dementia, because as you probably know, there is no definitive curative treatment for dementias like Alzheimer's as yet, despite billions of dollars being spent on it. So menopause is something you need to keep in mind. If you are going through menopause, or even the perimenopausal period actually can be quite challenging for a lot of women. And perimenopause is the 8 to 10 years before the actual menopause. So menopause by definition is sort of a retrospective diagnosis. So you need to be not having a cycle for 12 months, and then you are considered to be in menopause. And of course, there are some blood tests you can do. FSH is one of the hormones. That test is available anywhere in the world, where once you have higher levels of FSH, you are considered to be in menopause. But the problem with a retrospective diagnosis is you may be 6 months into menopause, but by definition, you are not in menopause because 12 months have not gone by. And many a time patients have been told, oh, you don't have hot flashes. So not every woman will have hot flashes as the main symptom of menopause. So your doctor will say, oh, you don't need hormone therapy because you don't have hot flashes. Hot flashes are not the only symptom of menopause. You could be experiencing insomnia. You could be having anxiety. You could be having brain fog. You could be having low energy, pains and aches all over the body, so many different things. And another very important symptom, which is often not people are not aware of, is weepiness. So women feel like crying more. So if you are like watching some movie on TV, which is, and you just start weeping, or you are watching it with your family, and your family has this habit of pushing the tissue box at you because they know you're going to start crying now, and you end up feeling terrible. I have experienced that, so I can tell you that is actually most of the time a problem of progesterone deficiency. And how I experienced it is, and I usually like to share this because weepiness is not something that a lot of women know. It's a symptom of low progesterone. There was a time when I was going through chronic insomnia, and I was doing all those, the sleep hygiene stuff of no high, daylight exposure in the morning, and in the evenings bring all your no bright lights and all those things. So I am on progesterone, I am on hormone therapy, and my progesterone comes in two different containers. And because I didn't want to switch on the light in the room, I couldn't see which was which. The two different dosages. So one is a much lower dose. Bottom line is I ended up having a lower dose of progesterone. And the next day, this was like, I was shocked at how dramatic the response was. The next day, and of course, I didn't sleep well that night. So I thought, okay, it's like, what am I going to do about my sleep? And I'm going through chronic insomnia. I'm a functional medicine doctor. Why can't I fix my own sleep? So just an aside, I fixed my sleep using cognitive behavioral therapy for insomnia. Hormone therapy alone did not do the trick. But anyway, because of the low progesterone that night, I didn't sleep well. Next morning, I woke up feeling terrible, somehow managed to push myself through the day. And then something happened and I started weeping, and I thought, oh my God, what is going on with me? And later on, I realized that night when I was going to have my progesterone again, that I had taken a lower dose the previous evening. So that explained my weepiness. So that is something I usually like to highlight, because weepiness very often is not considered as a most people are not aware that that's a symptom of menopause, and it's not like you're going crazy or you're this stupid woman who's I don't know what else we are called. Nutritional deficiencies is another big one, particularly iron deficiencies and B12. So if you are someone who doesn't eat a lot of meat, if you're vegan, vegetarian, it's very unlikely you're going to get enough iron. I find iron deficiency, and most of my patients are from India. It's like a large percentage of my patients have iron deficiency, including men, actually. I'm surprised because most of the time we are told that more women than men have iron deficiency because women bleed, menstrual bleeding makes them lose blood. But I have found a lot of my men patients as well, and quite often it is nutritional for them, because even if they do eat meat and fish, they don't eat enough. B12 is another one, vitamin B12. These two are the commonest ones, and vitamin B12 deficiencies are common in people who are vegetarian or vegan, or even some medications like metformin can deplete you of B vitamins. Statin medications, so cholesterol lowering medications, can do that as well. So basically, my point in sharing this slide is, if you or a loved one is going through mental health challenges, have these things been ruled out before, before being put on some prescription medications for any of the psychiatric medications. Sometimes, see, iron deficiency, B12 deficiencies, these are relatively easy to cure, actually, I would say, not just treat. Of course, if you are not going to get these from your food, you need to be on supplementation long term. Then this is another very important paper, which again, this is open access, so you can go through this. And what I liked is the title of the paper is Functional Neuroimaging in Psychiatry, Aiding in Diagnosis and Guiding Treatment, what the American Psychiatric Association does not know. And this is actually really very significant, because a few years ago, the American Psychiatric Association, and there are many other countries which follow the recommendations of the American Psychiatric Association. So the APA decided that brain imaging has no role in psychiatric conditions, but that is not true. So this is a very good article. And and I have talked about brain trauma before. So 40 to 50% of people who've gone through brain trauma experience depression, suicidal ideation, anxiety, irritability, all these problems, and also hormonal dysfunction. And very often this falls below the radar because no one is thinking of that head trauma before. And like I said, people forget. And in fact, just after I finished my certification, we had a patient in our office here, and she was talking about a whole lot of anxiety and all these things, and she said, I'm doing all these things with my food and everything. And we asked her about head trauma, and she said, oh no, I have not had head trauma. She went home and she sent us an email saying, you are right, I had a skiing accident and I had to be airlifted out of the ski slope. So such a severe and a major event in her life, she didn't remember. And this was like just 7 or 8 years ago. She said, you are so right. After that head trauma, I went through all these challenges and I'm not even thinking of that now. So head trauma is something we all have to remember and keep in mind when anyone is experiencing these things. So that is, I'm going to, so now please feel free to either raise your hand and I will unmute you, or you can, okay, I can see one more raised hand, or you can even type your questions in the chat box or the Q&A. So Amy and Julie, one thing, I'm not sure how to edit this out. So this is being recorded and it will be on my YouTube channel. I will try to edit this part so that I don't include both of you in the video. But Amy,
Oh, I'm fine.
oh,
I'm
okay.
fine.
Thank you so much.
I'm fine. Just my son anyway. So I have a doubt. Actually this question is not related to brain injury, that kind of stuff. Actually you mentioned menopause.
Mm-hmm.
I was wondering if I needed any therapy, hormones therapy. How do I know if I have issues? What kind of test I can go about?
Oh, okay. So again, this is not medical advice. On my website, there is a menopause questionnaire, and feel free to just email my office, info @drkarmd.com. I'm going to put my email.
Yeah. Can you
I'll
put
yeah. So and you can actually just do an internet search for menopause questionnaire, North American Menopause Society. And again, Amy, it will depend on which country you are in. So what you can do is, in that questionnaire, there's a list of symptoms, and you can complete that questionnaire and take that to your healthcare provider.
Mhm.
And the North American Menopause Society website has a lot of information because there is a lot of misinformation about hormone therapy. Most of the time, people are given the impression that hormone therapy is dangerous for you. It's going to give you breast cancer. You're going to die early. That is not true because hormone therapy today is very different from hormone therapy back then. And I did talk about hormone therapy on some other webinar. But the message I want to give you is, Amy, you need to advocate for yourself. So hormone therapy, if it is estrogen, which is applied as a patch or a cream on the skin, and
Mhm.
oral micronized progesterone, which is structurally, the chemical structure is the same as the progesterone your body makes. Both of those are not related to cancer, breast cancer, or anything. In fact, we have enough studies to support the fact that if women are not offered hormone therapy, that is a big disservice because there is a certain number of years. So 5 to 6 years soon after menopause is what is called the window of opportunity. But the fact is, if you're older than that, if you have crossed that window, it does not mean that that will not be beneficial for you. So number one, go through your symptom list, and if you feel that, and this is like a gradation of the symptoms, and go to your healthcare provider with that symptom list and have a conversation. And if your healthcare provider is trying to tell you hormones are going to kill you, and again, I don't know your medical history, there are certain conditions where you should not be on hormones, like hormone dependent cancers and all that. But you need to have a conversation with your healthcare provider, and particularly if anyone is trying to scare you away from hormones.
Yeah, actually, I don't have any hormone-dependent cancer so far, but what yeah, I do have some symptom. I'm not sure it's related. That's why I need really check that list you said.
Yes.
I'm gonna actually email. Oh, did you say on your website, or can you put the link in the
Yeah, I
chat?
think that is what I'm going to do. So there are
Okay,
two more questions that one is, what
sure.
is the
Thank you.
best? Oh, thank you, Amy. Thank you very much. So one question is, what is the best drug or herbal for brain fog? There isn't one drug or one herbal for brain fog, Sayed. I'm sorry about that. But on my website, again, there is a free download of an ebook. What are the 5 things you can do for brain fog? Because the bottom line is, brain fog can be a symptom of so many conditions. And most of them actually are manageable through lifestyle changes. So it's difficult to say, but there is no one medication or herb which is going to take care of brain fog. Is concussion? Yes, concussion is considered a traumatic brain injury. And there is a lot you can do for concussion in addition to what your doctors recommended. And you can check, actually, I keep mentioning Dr. Amon's clinic. Just send me an email. I'll send you the name of the book. I'm just missing out on the name of that particular book. Basically, a lot of anti-inflammatory. Then some people have also used hyperbaric oxygen, HBOT therapy. So you need to find out what actually applies to you if that is something you're dealing with. So I am going to look for that menopause questionnaire and post it here. Meanwhile, if you have any more questions, feel free to ask, and I'll just look for that questionnaire. And in case you are unable to download your answers from my website, just send an email, because sometimes it's a simple technical glitch. Oh, I'm having challenges with my internet today. There it is.
Sorry, doctor. Chat
Oh,
was disabled.
I'm sorry about that. One minute.
Yeah, chat has been disabled. So can you post it in the question and
Yeah, I
Q&A?
will do that. I am so sorry about that. Yeah, I think sometime back I changed the settings. So I think what you need to do, Amy, is you need to send me a. Okay, I think I can change this. Yes, I can change it to. I have changed the settings on my chat box. So I have posted the menopause questionnaire there. Can you see it? You should be able to see it now. Can you?
Yeah, I can see it.
Yeah. Okay. So I have posted my email, clinic email address as well. In case you have some challenge after filling in that questionnaire, please send an email and we will send it to you. So I don't see any other questions. Thank you, everybody. Thank you for joining me. And thank you for agreeing to, your name showing up on my videos. Thank you very much. And next month, it's going to be on fatty liver and brain function. Again, not something you think about usually. So, okay, Julie, I'm going to unmute you. Oh.
Hi.
Oh, yeah. So you, sorry, I thought I couldn't unmute you. Go ahead.
Because I couldn't post in the chat, I just wanted to thank you for your time. I appreciate it.
Thank you, Julie. Thank you very much. Okay. So
And
bye
take
now.
care.
Bye.
Bye-bye.
Bye. And if you have any questions, feel free to email them to me. And if I can respond on an email, I will. Otherwise, I will bring it up at the next webinar. Thank you and bye now.